All right. Thanks everyone for joining us. I'm giving folks just another minute or so to join us. So thank you for your patience, and we're getting excited about our presentation today. All right, let's go ahead and get started. So welcome to our monthly virtual Lunch and Learn. Is the FAITH Network, Faith Academic Initiatives for Transforming Health Network. I am Dr. Kenesha Bryant Moore, who serves as the director for the FAITH Network. And we're excited to hear about climate change and how it impacts our health today. We have with us Ms. Rachel Hale. She's an instructor at the UMS College of Public Health in the Department of Environmental Health Sciences. And she is starting to launch her independent research career. And so I think this is going to be a great opportunity for us to learn from Rachel and what she's interested in researching, but also for us to talk about potential partnerships and ways that we can bring to light some of the things that we're seeing within the community. So we do ask everyone to stay on mute during her presentation. If you have any burning questions that you would like to ask and you're afraid you may forget them, please feel free to go ahead and drop them into the chat. But we will have time at the end of the presentation for questions that Ms. Hale will be able to answer. So without further ado, Ms. Hale, go ahead and start your presentation.
Morning, everybody. Thanks again for letting me have some time here to talk to you about how our changing climate is affecting our health. I'm excited to be able to share. I'm very passionate about getting this information out there, and so we can protect our community's health, our individual health, and really learn to adapt to how our climate is going to be in the future and how we can live our fullest lives. So I'm going to get started. So kind of the plan for today is we have to talk a little bit about why and how our climate is changing, how these changes are going to affect our health. They're already affecting our health, and how they're going to affect us more so in the future. Who is the most vulnerable? And how is what's happening in Jackson, Mississippi right now related to our changing climate? And finally, how's the faith community already responding to protect the community and our environment? And what are ways that we can do as individuals and communities to kind of work together to ensure that our communities are adapting and becoming resilient to the effects of our climate on our health? And so, why is our climate changing? Well, there's a couple of reasons. We as individuals, we consume a lot. And so we're driving our cars, we're flying planes, we use a lot of oil, natural gas, And that puts out carbon dioxide and methane and nitrous oxide out into the atmosphere. And so that is warming up our environment. It's warming up our oceans, it's warming up just our earth in general. And when we change our climate, we as humans, our health is reliant upon our climate. So our health is going to change. And so, what are we seeing? We're seeing more droughts and wildfires. You can see that happening in California right now. They're experiencing quite a few wildfires in combination with the historic heat wave, and as well as a very rare Hurricane K that is off the coast that has been flaming the fanning the flames. So slow down a little bit. Fanning the flames of the fire, making that spread. Last I read, it burned about 19,000 acres, and we're going to be seeing less snow and ice. Our temperature of our oceans are going to warm. Here, we're going to be seeing some stronger storms. Our habitats of our ticks and our mosquitoes are expanding, and all those things have an impact on our health. And so, kind of what I just talked about, we have higher temperatures, our sea levels are rising, which means we're going to have more extreme weather. We're putting more carbon dioxide into the air, and that brings on these effects on our climate, our heat waves, droughts, wildfires, more hurricanes, typhoons, and less clean air because of ozone and smog. So, what are we going to see in Arkansas? Because lots of times people think, okay, we're not on the coast, so we might not see these effects. We're already seeing them. We're seeing longer summer months, more extreme heat. We're seeing stronger storms, more destructive storms, flooding. We're getting a lot more rainfall than we used to. You can kind of look back at the 2019 flood that's destroyed crops along the Arkansas River. And so our changing climate is affecting our health both directly and indirectly. And so, directly is that intensity and frequency, how often these extreme weather events are happening, such as heat waves and flood. And then, indirectly, we have worsening air quality. We have changes in the spread of infectious disease. We have threats to both our food and water, as well as the effects this has on our mental health. And so, this is, a pretty busy thing, but I kind of just want to show all the different sectors that's going to be affected. So you have in the middle more extreme weather, rising temperatures, increasing carbon dioxide levels, and rising sea levels. All these things are going to exacerbate our existing health inequities. And so, what do I mean by that? That can be we are going to see more asthma and cardiovascular diseases within communities of color because you're on the front lines. You've been placed on the front lines because of redlining and other systemic racism. There's already existing health disparities. When you bring on a change in climate that's going to affect our air quality, your health outcomes are going to be worse. You see environmental degradation. So basically, when a community loses their crops and maybe their soil is no longer fertile in order to be able to plant, they're going to have to move to different parts of either within that country or within that hemisphere. And so when they move, you have mental health effects of having to lose your sense of connection to the ground that you were brought up on. You can have civil conflict. You can have an increase of violence. So it affects, the gamut of health issues from physical to emotional and to spiritual. And so bringing it back to Arkansas, what are we going to see? We talked about the flooding. That's a picture from the 2019 flooding event. We're going to see increased precipitation, stronger storms, so high winds, hail, lightning, tornadoes, and extreme summer heat. We're going to have longer summer. And so how is that affecting our health in Arkansas? Well, we can see more incidents of heat stress that leads to exhaustion, that then leads to stroke, heart and breathing issues, some kidney issues. When you're dehydrated, like repeatedly, you can really have effects on your urinary tract. You can have chronic kidney disease. And we're seeing that specifically within farm workers in South America right now. We have longer pollen seasons. It's warmer for longer. And the pollen is stronger because we have more carbon in the air. So we are feeling our allergies, our burning eyes are happening more so. So that is already happening here. We are going to see, unfortunately, more mosquitoes and ticks, though they have a longer season of reproducing because of their habitats. Their habitats are expanding. So that means we're going to be more at risk for Lyme disease and West Nile virus. And then with these warmer temperatures or this flooding, farmers may need to use more pesticides, which can get into our drinking water, as well as it's exposing those workers that are having to apply the pesticide to the fields. And when we lose our crops, our food prices can go up. We lose our jobs, we lose our livelihoods, again, affecting our emotional well being. And just, when you have extreme weather, you have a risk for injury or death. As you can kind of see, this is affecting every avenue of our health. There's been correlation between heat and low birth weight and preterm delivery because of a increase in oxytocin. Our homes are destroyed, our workplaces are destroyed. And, one example of the disruption in medical treatments in Hurricane Maria, a lot of the deaths were after the actual hurricane because they couldn't continue their care of either dialysis or chemotherapy and radiation. They couldn't get to the hospitals or the facilities to have that happen, as well as there was rampant power outages that happened for a long time. They didn't have access to clean water. So if you're thinking about needing to clean a feeding tube or any medical equipment like that, you're going to have disruption. With warmer water, we have more opportunities for our bacteria to grow. And so that can lead to stomach illnesses, like an increase in diarrhea. With flooding, mold can get into our homes. So if you already have asthma or respiratory issues, that can really lead to more emergency department visits. And then another aspect, and I hope I've kind of hit on it a lot, is decreasing emotional wellness. There has been some research that shows there's an increase in suicide, domestic violence, gender-related violence when these kind of events happen. And so, who is the most vulnerable? Well, it's the elderly. It's going to be children. They have a limited ability to regulate their body temperature, so they are going to be more vulnerable to heat extremes. You think of the elderly community and their access to transportation, or maybe they live alone, so people don't know that they're getting exposed or their AC has gone out. Pregnant women, their bodies are changing, they're holding another life, and what that means. Individuals with pre-existing conditions, so that can be asthma, that can be COPD, that can be heart disease. And when you bring in the effects of climate change on those existing illnesses, you are going to see those worsen. Communities of color. We live in a society that is, unequal. So we are going to see communities of color who have existing health disparities. They're already on the front lines of these effects of climate change. One indicator that research has shown that you're more likely to live in closer proximities, closer distance to an industrial site, like a Superfund site, an oil refinery, something along those lines. Because if you're Black rather than if you're white, it's not determined on your wealth, it's determined on your race. Outside workers, the people that are out there doing our construction work, the farmers, our first responders, firefighters, those that are fighting the fires in California right now, they're more vulnerable to the effects of air quality, air pollution, or air quality, extreme heat, mental health from having to respond to these effects. Women, we are seeing more so in international settings, we're seeing women be exposed to more violence. When you're having to travel for water and now that water is no longer available at that spot, you're having to go even farther out. You're more exposed to gender-related violence. Our housing insecure community, our homeless community, luckily in Little Rock, we do have cooling stations when it gets when it gets really warm outside, but we are lacking a lot of preparedness and being able to adapt and build resilience within these communities alongside these communities to help us protect our community's health. And so, one thing that I want to get across is yes, we absolutely are all all feeling the effects of climate change on our health. Absolutely. But we're not feeling it equally. The burden is unequal across communities. And that really is because we are in a world of historical and rising inequality. Here are more so some statistics a little bit of communities of color breathe in 40% more polluted air than white communities across the US. Another example would be the United States is the number one emitter of all carbon, methane, nitrous oxide, but we feel the effects less than, say, Pakistan, that is going through a really bad monsoon season, yet they feel it more so than us. Pipelines are often rerouted to go through indigenous lands to avoid white neighborhoods, so you're building upon existing health disparities there. And then racial inequality also means that people most at risk from our changing climate have the fewest resources to cope. And then, communities of color have been talking about health disparities. So what does that mean? There's higher rates of diabetes, respiratory illness, cardiovascular disease, higher rates of maternal morbidity and mortality in communities of color than their white peers. And that is identified by the CDC. A driver of racial and ethnic health disparities is racism. And so that brings us to Jackson. What is happening in Jackson, Mississippi right now? Right now, about 200,000 people are without access to clean water. The Pearl River flooded after this area received historic rainfall. So there is the climate driver, the climate hazard. They are experiencing more rain within a short amount of time than they would typically see over a couple of months. So this resulted in 2 large water treatment plant failures. There wasn't water to flush the toilets, to fight fires, in addition to temperatures being over 90 degrees, but feeling like 104 because of heat index. We can relate to that in Arkansas. It's an 80% African-American community. A lot of the white community moved away after integration. And so tax revenues went down and resulting in less money for infrastructure, including water infrastructure. And so there are tons of relief efforts happening right now, but this isn't where water systems for Jackson started. They started way back. One example will be March 2020, EPA found a potential for bacteria like E. coli in their water system. They were under boil water advisories since July 2021. Then the winter storm hit, pipes rose, people were without water for weeks in 2021 as well. And then October, Jackson children actually sued the city over the water system failures and mismanagement because they believe that there is lead in the water as well, and that is still ongoing. So you have this lack of investment in the African American community, really rooted in redlining and white flight. And this has led to this community being on the front lines of a climate hazard, that climate hazard being flooding, and that can all be related back to our changing climate. And this is having effects on the health of those that live in Jackson. With this extreme heat, you're going to see higher rates of dehydration, potential for heat stress, heat exhaustion, heat stroke for those vulnerable communities of the elderly and the children that might have asthma or inability to regulate their body temperatures. So this is happening right here and right now. But the one thing is, we still have time to do something about it. And the faith community is already responding. These are just two examples that I wanted to share with you all about how the faith community has responded. The first one is Cool Congregations. Arkansas Interfaith Power and Light they've received grant money to provide energy efficiency to help reduce utility bills and improve human environmental health. So when I say provides energy efficiency, that's providing insulation, replacing appliances so they're more energy efficient appliances. And they're really trying to get this in all parts of the state. This is a free service typically, and I can give you the contact information for Sharma Russell, who's the executive director, if your community might be interested in this. And then Faith Force is also a faith-based program out of Mom's Clean Air Force, which created a climate-focused Bible study to kind of talk about the faith communities rooted in shared love of the earth. So that is just two examples. There's many more. There's a lot of churches, from your mainline churches to your evangelical churches across the board, really responding to what is happening in our world right now. And so what else can we do? We can learn how to protect our community. You can share what you learned today and bring it back and say, this is what's happening, and maybe this is what we could do in our community. We could all learn the signs of heat-related illnesses so we can prevent a heat stress environment from going to a heat stroke. In implementing extreme heat first aid, we can co-lead to build more, to plant more trees, to have more permanent cooling and warming stations, to create neighborhood level disaster preparedness. So, and changing how our homes and our neighborhoods are designed. Another example is through Arkansas Interfaith Power and Light. They're doing a lot of backyard gardens, and that kind of helps when there is a disruption in food distribution. And so when you still have food in your backyard, when maybe extreme heat or even extreme winter weather, because that is still happening, prevents food from getting to your neighborhood, you have the ability to have that resiliency built in to share with your neighbors. Advocating for infrastructure funding that really takes into consideration what our climate is going to look like in the future. So if we only build it back to what it was before, some of these levees, some of these our water systems and stuff will not be able to kind of work as well as they really need to in how our climate is moving. And my little plug, work with researchers to understand more about the impacts of changing climate on your community. Like, very curious about what you're seeing in your neighborhoods. If you're seeing more parishioners or community members saying they are having more heat fatigue, or they have limited access to clean water. And, these are just a few examples. And the one thing I would kind of want to leave you all with is, like, there's still time, there's hope. We can protect our community's health. And, we have the ability to do that. So, big summary, our climate's changing. It's already affecting our health. Some communities are more vulnerable, and we can do something to protect our community's health. And that's it. So I'd love to know if y'all have questions or anything. And I'll stop the presentation so we can just chat.
Yes, and I've checked the chat. So if you are shy and would rather put your questions into the chat, please feel free to do that as well. Or if you like to ask a question, you can use the raise your hand feature in your, at least it's in your reactions rather. You can raise your hands that way as well. So I'm going to start it off because I'm not shy and I'm full of questions. So I was not aware that there were some faith-based programs already in existence to address some of these issues. And I think because I previously have done some work with folks who are experiencing homelessness and housing insecurity, that is like one of the greatest things I get concerned of about our weather here in Arkansas, just since I've been living here, like the last 13 years, seem to get a little bit crazier every year. And a lot of people's like, oh, that's just Arkansas. But then my parents, they grew up here and they were like, no, it wasn't it wasn't like this before. And so when I'm thinking about people who are living in tents, living in the streets, or just in their cars or vehicles, and we're having these extremes with extreme heat this summer that it was so intolerable. I don't think we took our bikes out at all this summer because it was just so hot. To just thinking about just that winter storm we had year before last, and being snowed in for over a week, which was painful. So do you have any thoughts about how, I guess, we can engage the faith community a little bit more, just to talk about these connections between the changing climate and then addressing the needs of those who are experiencing homelessness and housing insecurity? That was a very long introduction to my question.
So let me make sure I got it. So it's how can faith communities kind of work towards using what we know about our changing climate to start addressing these more vulnerable communities? That's what I heard. Okay.
Right, exactly.
Yes. Okay. So I think there's a lot of ways. So it definitely learning who the most vulnerable are, and it's the same communities that are vulnerable to other things. But speaking of like the housing insecure homeless community, and I think of Little Rock. So there is a church downtown that opens up their center for when it's too hot outside, or they distribute water bottles. And then and so the one thing I have to think of too is there is policy level interventions that I think faith communities can advocate for. And that can be just local city ordinances. So where can homeless community put their tents up? If they aren't able to move into a shelter, because there are barriers to moving into a shelter. And if maybe, so that could be, let's have a designated area, and this is going to be a shaded area that has access to clean water, work with other organizations that can bring in mobile showers to make sure there's clean hygiene. So you can avoid some of those issues. But really, I mean, I think the one thing that I see, and I'm from rural Arkansas. I grew up in the church. And the one thing I always thought about was, we have this community building. We have a building that's my church was not being used from Monday to Saturday very often. So when these kind of events happen, if we focus it on a neighborhood level, we can open the building. And I've seen churches do this in disaster response. So there is capability, there's community built in that we can respond to maybe the extreme weather events. The other thing is, the faith community that I have seen already kind of checks on the elderly that are at home. Brings meals. We'll maybe do that, especially when there's an extreme weather event, and start noticing, do they have an AC? Do they have, and then in the winter, do they have heat? Do we need to maybe see if they can go to a family member? Do they need transportation to the grocery store? Instead of having to take public transportation in the extreme heat. Because that's the other thing, if you notice when you drive around Little Rock, we don't have a lot of great infrastructure for public transportation. If you are waiting on a bus, you're waiting 45 minutes out in the direct sun. There is no shade or covering at most of the bus stops. So that's one intervention that could happen. And then with Arkansas Interfaith Power and Light, they do quite a bit with let's get our actual buildings more energy efficient. So we're putting out less emissions. So we're improving the environment's health, which then improves our health. They do a lot of advocacy work. There's some other things about there's our and I'm not saying whether I'm for it or against it, but like there's penalties from owning a hybrid car within Arkansas. You get penalized $200 on your property tax, as well as electric vehicles. You get an additional tax for having that. It's a yearly tax. So there are things that you can advocate for as a community. That was a long-winded answer. Did I touch on what you were asking?
I gave you a long-winded question, so that is quite fine.
Okay.
And I'm checking the chat again. I don't see anything there. Did anybody have a question? If not, I'll keep asking questions.
Keep drilling.
All right. So my follow-up question is prevention. Because you kind of talked about it, like emissions, those types of things. We've talked about policy level. We've talked about kind of changing to energy efficient, items within or appliances within homes and things. What else can we do as individuals to kind of be preventative of making the the environment and the climate change from getting worse than what it is?
Yeah, so a couple of things. One could be switching from individual level stuff that you can do. If you have access to public transportation or using a bicycle or anything along those lines, it's called active transportation. That's great for your health to build up your overall health, as well as helping the environment. You can be involved in community gardening, growing your own food in your backyard. That helps your individual health, your neighborhood level health. You work with one another, and your physical health. Another thing could be reducing how much red meat you eat. Unfortunately, the way we have moved towards mass production of red meat, we let out a lot of methane from that. So even just reducing your meat by a little bit can help. Less consumption. So reusing the stuff that you already have in your house rather than going buy new, trying to avoid plastic. Trying to do just small actions can definitely lead up. I think it's going to be, and all those actions result typically in overall physical health as well for you as an individual. And the healthier you are, the more resilient you're going to be for when our climate is changing. Because we are unfortunately committed to seeing warmer weather. We are right now, we can't really go back that because carbon, exists in the air for 1,000 years. So we're already committing to having the weather that we're having right now, but we can be more resilient in our families, our friends, our faith communities. And the one thing I will say, we're still learning a lot. This is a pretty new field of how our climate is changing and what are the best ways can we adapt and respond to this, that we can protect our community's health while improving the environment and not harming the environment more. The one thing I think about, when there's a water crisis or any kind of issue that affects water quality, we have to go to plastic water bottles. That costs money. That's a barrier to individuals that don't have access to that. Plastic stays around for a long time. So that's not really a good, long-term solution. And another thing would be just ensuring that you have access to clean water. And if you find out that you don't have clean water, start working towards either working with researchers to figure out what's in there, what can we do to change this, and using what you learn in those relationships to then take it to your city officials and take it somewhere so your infrastructure and your water quality can be better. Sorry, I do see questions in the chat now too. So
yeah, so you did have a couple of questions pop up, which is awesome. The first one is, are we seeing any definitive studies at this point linking the exacerbation of these issues to climate change yet, specifically in Arkansas or in the South?
So in Arkansas, not as much, just because we are not a coastal state. A lot of the research has come out of Louisiana, anything on the Gulf Coast. You're seeing more research studies coming from there, especially New Orleans. I think we can all, I can think back to Hurricane Katrina and see, how extreme that hurricane was, and then the infrastructure failure, the levees breaking, and the communities of color that were affected the worst, and then the lack of response and disaster response. So definitely along the South, I may have to get your phone number and your email, Laura, and share some of the other articles that I have. We're starting to create more information about what is happening. We're starting to conduct more research about what is happening specifically in Arkansas, and that's kind of what I want to do. That's where my passion is, because I think there's a lot of unknowns. There's a lot of knowns, but there's a lot of like really solid information out there right now. Yeah. Did I answer your question?
Yeah, thank
Okay.
you. And I'll connect with you. That would be great to.
Yes, absolutely.
Thank you.
Mhm.
And the next question is there anything that we can learn from other countries that have experienced extreme heat forever? So what are other countries doing?
So other countries, when there is infrastructure available, they do heat action plans. And I would say, there's communities in the United States that have enacted these heat action plans. They're typically community led. They're sometimes co-led with researchers, but the one thing that is probably across the board is having to work across sectors. It can't just be, the medical field responding. It needs to be city officials responding, public health practitioners responding, faith leaders, community leaders responding. It's going to take all of us kind of working together, farmers responding, because it's affecting every sector in our life. So really, we have to get everybody on board if we're going to move forward in interventions that really are going to adapt us to our new climate. So, certain communities they've created, there is a focus on like neighborhood level plans or city, specifically neighborhood. And so, one example is there's someone assigned to go check on individuals that are over a certain age during extreme weather events, to physically go check on them. There is someone else that responds with like grocery delivery. So people that are more vulnerable with pre-existing conditions are not having to get out in the heat. So a lot of it is like protecting the most vulnerable, which I think is, to me, a tenet of many faith traditions. And for us that have more of a healthy, or just are lucky to be healthier, able to go out and do things and help and assist to protect people from the elements. Another is figuring out, where do we need to build and not build anymore? How close should houses be to certain bodies of water? And with that, if it is having to move communities away from like their indigenous land, respecting that. There have been ceremonies that indigenous communities have conducted to say goodbye to a specific part of land to be able to then move, because that is so entrained within their identity as a community, as a people. So that's one thing I think we've seen in Louisiana, in some of the parishes closer, of course, to the Gulf. And then, so another thing with extreme heat is we have this thing called the urban island effect within cities. Think of Little Rock, Chicago, New York, Cairo. If you want to think international, you have a lot of cement, a lot of asphalt. And so that is just making the temperature rise more and more. So temperatures in cities can be 10 degrees higher than communities that are in rural communities, because they don't have the trees, the green infrastructure that is really needed in order to reflect that heat back out. So that is one thing: planting trees, having rain gardens, really changing the design of how we structure our buildings, and what that looks like. But yeah, so I think it's like piecemeal a little bit. Like there's certain communities doing this, certain communities that. But the one thing I will say, the overall thing is getting as many people to the table as possible from different, bringing an architect in, bringing an engineer in, bringing a public health researcher in, bringing a faith leader in. Like if we can all kind of come together, partner on these things, then we really see the interventions being sustainable and lasting longer. And I do have resources on how to develop a rain garden, so I will send that out as well. They're really cool. They're really cool. Awesome. I will send that.
Well, thank you. I don't see any other questions in the chat right now. I did put Ms. Hill's contact email in there. So if you want to shoot her an email directly, we can do that. Also, because you registered on Eventbrite, we can very easily email out the slides and the additional information that she has offered to share today. Are there any other questions that you want to come off the mic and ask? I always have one in my back pocket.
Yeah, I just think this is great.
All
I mean,
right.
I never really, this is Steve Sullivan.
Oh, hey,
And
Steve.
I never really thought about, the impact of climate, I guess, specifically on health locally. I've thought about climate in terms of Arctic crap and stuff like that. But yeah, so I think that's kind of cool what you're doing. So I appreciate the presentation.
Thanks. And it's good to hear from you. It's been a while.
Yeah, it's been a while. Yeah.
I know. Well, and that's, the one thing is I would love to hear from you all, and it can be, offline. We can definitely hook up by email. Love to have a conversation. If you want to sit down for coffee or tea, that's great too, because I'm really just trying to learn what is happening in various parts of the state, and what are the concerns of the community, and how can we work together to kind of work to address those concerns. So I'd love to hear from anybody that's interested. So please email me. I love talking, if you can't tell. So I'm more than happy to answer any questions and just have a conversation.
All right. So I will pull out the other question out of my back pocket. We still have some time. So you mentioned what's going on in Jackson, Mississippi, and immediately I go back to the Flint water crisis. I'm from that area. I had family impacted by that, and ironically, a few months before the Flint water crisis just hit the national news, my aunt was down here in Arkansas visiting, and she had noticed. She was like, "I don't know what's going on with the water. My plants are dying." And so just thinking proactively, as individual citizens who have, city water and trying to get it from the tap, is there a way that we can test our own water?
I want to know the answer to that. I know that city water is tested. And I have heard of individual tests that you can have at home. I've seen them at, I think, Home Depot or Lowe's. And sometimes they offer them for free. I've seen them at the register before. So you can definitely test your own. And I think, if you're noticing weird taste, weird smell, or anything like that, I think, either expressing your concerns to a researcher or talking to the Department of Health to get someone else out there to test it is crucial, because the one thing that we need to ensure that we have is access to clean water. Absolutely. And I think there's tons of researchers here that have expertise within water quality that I think they would be willing to have a conversation about that, because that is one way to ensure that you're resilient to how our climate is going to change. Because where we are in the South, extreme heat is going to be an issue, as well as flooding. And so when you have flooding and you have pesticide use, that can all get groundwater contaminated and it can lead to other things. So definitely you can test your own water and then, report any symptoms that or any signs that you're seeing to the appropriate officials. And as always, as I'll always say, you can work with researchers.
So just talking out loud and going through this, I almost want to do a session on that of how do you test it if you're concerned, and then how do you then follow up, because a lot of times I think people don't feel empowered to be able to do that. And so it's like my aunt, she has since passed then from COVID, but she noticed something and she knew her plants were dying, but she didn't feel empowered enough to be able to test her water and then to talk to somebody about it.
No,
So, okay, we got a few more minutes left. Any burning questions that you can either drop in the chat or you can come off mute. I also just dropped details in there about our next virtual Lunch and Learn, which will be next month, October the 12th. We always do our virtual Lunch and Learns the second Wednesday of the month at noon. And our next speaker will be Dr. Tiffany Haynes. I think she actually is going to be bringing some friends along with her to talk about mental health. And so we invite you to join us again next month. Details about a little bit more specific about who all the speakers will be and the topic. So it's mental health is pretty broad. So I'm sure she's going to narrow it down a bit. So just please look out for information on that as well. And if you are not on our newsletter, please let us know that as well. I can drop my email in the chat as well. Or, I'm always interested, if you're interested in a specific topic that we have not covered, that you would like either a researcher from UAMS to come and talk or one of our community partners to come, feel free to shoot me an email about that as well. So I'm checking the chat again. All right, I think that concludes our questions for this session. So Ms. Hale, thank you so much for being with us today. And I look forward to more conversations with you about how the faith community can partner with you in your research as you build your career here.
Thank you, Kanisha, and thank you everybody for letting me have this time. I really appreciate it.
All right, so we'll see everyone next month then. Thank you so much.
Bye.
Thank you.
Thank you so much.